Good evening, ladies and gentlemen. Thank you so much for joining us this evening. We do thank you and appreciate you for your time. We will begin the webinar in just a few moments. We're giving individuals enough time to log on. Sometimes it's a little technically challenging to do so. I know I had some myself. But once we begin, we will have a Q&A chat that's available at the very bottom. Feel free to put your questions in there as we go along. That's because, unfortunately, this is a webinar, so we can't see you or hear you or answer your questions live. So putting them in the chat, we will do a Q&A at the very end. At this time, I am going to launch a poll, a questionnaire that we very much would love for you to fill out. It's very helpful for us if you do fill this out for us. It should show up on your screen in just a moment. Again, we are going to begin in just a few minutes. If you can answer the poll for us, we'd greatly appreciate it. If you have any questions, go ahead, and if you came with questions already, you can go ahead and put it in the Q&A chat box, which is at the bottom of your screen. As we go along and you develop questions so that you don't forget, go ahead and put them in the Q&A chat box, and we will address those at the very end. So at this time, I am going to turn it over to our Medtronic field sales representative, Janelle, who's going to introduce our provider for the evening.
Hi, everyone. Good evening. Thank you for joining us tonight. I have the pleasure of introducing Dr. Forstner, who has been in practice for almost 20 years now and has been offering InterStim therapy to her patients for over 10 years. Dr. Forstner is a board-certified colon and rectal surgeon who founded a thriving colon and rectal practice after returning to the Valley in 2006. She received training at Mayo Clinic Scottsdale after attending medical school at the Mayo Clinic in Rochester, Minnesota, and received her specialized surgical training with the Colon and Rectal Clinic of Orlando. She spent most of her career focused on anorectal as well as robotic and laparoscopic or minimally invasive surgical approaches to cancer. She now focuses just on anorectal disease and diagnostic and screening colonoscopies and treats all forms of benign colon and anorectal disease. She continues to pursue cutting-edge approaches to issues such as the sacral nerve stimulator for fecal incontinence. So without further ado, here's Dr. Forstner.
Hello, thank you so much for joining us, whether you're with us tonight as we're actually shooting this webinar, or if you happen to log on and watch this at a later date via email or via a link on our website. Appreciate your time that you're taking just to learn a little bit more about incontinence. And I'm going to take the next half an hour or so and just try to answer any questions at the end that have come up. And so, as mentioned before, if those questions come up at any point in time, just type them into the chat box. Janelle will be monitoring this, and we will get to all of them at the end. It is amazing at how many people in my practice, when they come and see me for whatever reason, we do ask about incontinence, and the number of people, I would say a good 30 to 40% of people that I see for any reason whatsoever are experiencing at least periodic accidents or soilage. Unfortunately, as we age, for some reasons that we're going to get into as we go further through these slides, there are multiple reasons that can cause this to happen. And many people don't want to bring it up with their providers. And so I hear all of these various questions or comments that are on this slide. And what most people aren't aware of, and what we're going to be talking about tonight, and when I see patients, I go into even more in depth, are that there are a lot of promising options for being able to control this and to have a better quality of life. And that's what we all want and what we all deserve, regardless of age. Bowel issues are not an inevitable situation, that they're not something that you have to accept as unchangeable. There is a portion of, as we get older, and some wear and tear, and as I call expiration of warranty on body parts or other medical problems that we can develop as people that can make this a little bit more inevitable, but accepting it as a chronic problem is not a required thing. There are very different ways that people will experience incontinence. It can be very mild in that after bowel movements, you just have a little bit of leakage, stained underpants. It can get to where you're having to run every time to use the toilet, or that every time you go to urinate, you're having to wipe and seeing something on the backside, to the point where people will start wearing pads or Depends in order to be able to continue enjoying their life and protect against this. This is something that, like I said, is so incredibly common, and people get very anxious about discussing it. A lot of primary care doctors aren't even aware of the right questions to ask, and many of them are not aware of all of the different strategies that we have in order to control and cure this in folks. So even the 1 in 12, I think, is probably a little under. Just even folks I see coming in for routine colonoscopies or other issues, a lot of them have sort of the beginning issues with urgency or soilage. This can happen when you're young. It can happen, again, more common as we age. And people are so humiliated that oftentimes they will live with this for several years before they can even bring themselves to see somebody like me. There are lots of different things that go into continence or bowel control. And part of it is our nervous system. Part of it is the food that we eat. Part of it is our muscles. When we eat, ideally, food moves nice and easily through our intestines and then triggers as it hits towards the rectum some nerves that signal to the brain, oh, there's something here. You should tell the body to start to head for the restroom. And when this all comes together nicely, nobody has the need to rush. You get an urge to go. You realize, oh, I need to go. You have plenty of time to get there. You can finish up the phone call you're on, for example. And when you get into the toilet, then your nerves work at that point to activate the muscles to then relax what I call the cork that we have at the exit. And then you have a normal evacuation. But there are a lot of different ways that this can go awry. And so when I talk with patients, I take a really detailed history, look at what's going on with them, what medications that they're on, and start talking, lead them kind of through the very conservative options for treating and curing this, all the way up to the advanced therapies. When we start with the conservative treatments, these are non-invasive. They can start just very simply. Again, I examine diets, people's diets that they're on, modify certain things. Sometimes probiotics are something that can be very helpful. And I do help patients kind of choose the right probiotics, because that can be very confusing if you simply go to the store and try to figure out which probiotic to use. But some of the issues with leakage or incontinence can be due to what's going on with your bowels more than what's going on with the exit. So we look at diet, we look at nutrition, we look at bowel consistency. When we're young, we have this perfect little cork at the exit. And even if we're having diarrhea, it holds up pretty nicely. As we get older, that cork starts to turn into a very tiny donut in a lot of us. And then we have to keep the bowels nice and formed, a little bit firmer, so that that muscle nerve interplay that you saw at the previous slide has a chance of triggering appropriately. There are all different kinds of exercises. There's very basic Kegel exercises, the old-fashioned squeeze and holds that we go over in the office with patients. However, some people are having this incontinence or this soilage or this leakage problem because they've had previous pelvic surgery, or they've had a motor vehicle accident, or they've had a sacral fracture, or they've had radiation to the pelvis for various types of cancer. And for those folks, doing the biofeedback, which we call kind of advanced physical therapy for the pelvic floor can be very helpful. There's a wonderful team in the Valley through Spooner Physical Therapy, and there are various hospitals that have specialty physical therapists that sit with folks and really work on retraining those muscles to get the muscles functioning in the pelvic floor if that is a problem, which it's not for everybody, but definitely there are a portion of patients who benefit from that. And it's not physical therapy like you think of after you have a knee replacement or an ankle sprain. It's usually anywhere from 4 to 8 visits over 4 to 6 weeks. And that can be of great benefit. And then there are medications and supplements. Yeah, I mentioned probiotics. There's different types of fibers that can be used to bulk the stools. There are medications that can be used to slow the gut a little bit so that the body can reabsorb some of the extra liquids that can lead people to looser stools. So these are all kind of what I call the entry level way of treating the incontinence when I see folks initially. There are then more advanced therapies. And in general, after I've sat with patients, or if you're watching this from out of state, if you sit with your colorectal surgeon and you speak with them, they'll start you on some version of this to begin with. Perhaps they'll just start with the dietary modification and the bulking and the basic Kegels. Then they usually will see you back after 3 to 4 weeks and then decide that maybe you need an extra physical therapy round. And then after that, you come back and see the surgeon. And most patients are slowly improving little bit by little bit with everything, regaining a little bit of their control, a little bit of quality of life, not having to plan their whole day around going to the bathroom or search for a toilet at every store that they walk into. But some folks will come back and say, Dr. Forstner, that was very helpful. However, it's not really working enough. I still feel that my bowels and the lack of control of them is controlling my life. And so that's where we have surgical options and we have the interstim option. Surgical options are when there are surgical issues. And sometimes there can be an actual rectal prolapse that needs to be fixed first. Sometimes there has been damage, obstetrical injury from episiotomy or tears with child delivery. And when we do imaging, we see that there is actually a defect or a gap in the muscle. Normally your sphincter muscles is 2 nice little donuts. And we can see a gap in those with imaging. And then we do surgical things. We can do sphincteroplasties. We can do something where we support the pelvic floor with a post-anal repair. These are helpful. However, they usually aren't the entire story because, again, bowel control is actually quite complex. It is a combination of optimizing the bowels itself, getting your muscles complete and strong, and working on the nerves. In severe cases, when we can't do anything that helps, or back when I was in practice for my first decade before they had the interstim for bowel, and when they only had it for bladder control, we would give colostomies fairly often. And that is the dreaded bag that nobody ever wants. But this is just a review of the various surgical options that exist. And with evaluation with your physician, they may find that they need to do this as part of the treatment. There are patients that I've had who come in with incontinence and a huge rectal prolapse, or incontinence and a huge tear in their muscle from a motor vehicle accident or previous child delivery or deliveries. And so first we surgically would fix that prolapse, or we would surgically repair the muscle. In general, that helps but does not completely fix the problem. And so we do that part first, optimize physical therapy, try to get everything that we can to tune up the body as best as possible. But we will often combine surgical procedures once people have healed. If they aren't totally in control of the bowels, well, then we look at those nerves. And the nerves for our anus, or your exit muscle, or what I call the cork at the exit, are very unusual in that what they do is they give a constant low level little bump stimulate, like a low level pinging to the muscles at the exit. And that's what keeps you tight like a cork. It's only when you consciously say, oh, I have to go to the bathroom, that then they relax. The problem is, as we age, and as many patients start to struggle with diabetes as a process of aging, diabetes does affect the small little nerves at the ends, and those small little nerves are what are going to your exit cork muscle. And so those nerves age, unfortunately, along with the rest of us. And then we start to get, again, where the cork starts to become a little bit more like a donut, not a big donut, just a little donut. But that can be enough to cause disastrous and humiliating problems for all of us. This device that Medtronic is the company that makes it, basically what it's doing is allowing for, kind of the way I've explained it, putting a cell tower in your butt cheek that adds an extra force to the little pinging of your nerve that's still trying to get down from your spinal column into those little muscles, and just boosts so that you go again from that little donut to, oh, now I'm back to a cork again. This is done through 1 to 2 very small outpatient procedures. The procedure is, we actually take a little tiny wire that's the size of literally a hair, and we drop it down under x-ray, and we connect it to the nerve in your butt cheek. So again, we're not into your spinal cord or anything like that. People get very anxious about that. It's a common question for me. And we do a little test. And if the test works well, as it does overwhelmingly for my patients, then we connect it to this little battery that you see on the screen, which is like the size of, and again, I'm probably showing my age a little, the size of a silver dollar. And that gets put underneath the skin. It doesn't cause a big bulge. It's something you only feel if you're pressing hard. And that runs for a good 10 plus years and just keeps this low level ping. In the beginning, of course, you feel it, but eventually you feel nothing. And that's also something that confuses patients. They can get very anxious. I don't feel anything. Is it still working? And yes, it's still working. And I have patients come in and check in with me kind of regularly so that we can assess. Sometimes we have to change the strength of the ping. Sometimes we have to change programs or the way that the device is talking to the nerve. But patients are thrilled over and over again. This is one of the funnest procedures I do, because patients go from humiliated and stuck in their homes and scared to even confess why they can't attend family weddings to family, to wearing white pants and living their best lives. For most folks, the process is a very simple evaluation. Some patients are able to get this nerve testing done even in our offices. Sometimes the initial nerve testing has to be done in an outpatient surgery center, but it's literally about an hour-long procedure. Patients are asleep with the exact type of drugs you get for a colonoscopy, so it's not serious major anesthesia. And then there's usually roughly about a week between that test and implanting the permanent device attached to that battery that was shown in the previous slide. This allows you to truly check and make sure that this is making a difference in your life and improving things. I stay in touch with my patients during this process. They're filling out a little questionnaire with the Medtronic folks as well. And we just make sure that this works well for folks. Again, literally 95% of my patients who have tried this at the end of that week say, oh my gosh, my life has changed. My quality of life is dramatically improved. And some of those patients may not get 100% control, but they're getting a good 70 to 80%, and enough where the options for their living has dramatically improved. And so then we just attach it to that little battery and make it permanent so that it lives underneath the skin. Another common concern I get from folks is, well, you say it's permanent. What if something changes and I have this thing, but I don't need it anymore? And I say that would be a wonderful thing to happen. It's happened maybe to one or two of my patients who went on to years down the road, have back surgery, and all of a sudden, amazingly enough, they got their bowel control back. Well, then we simply put you to sleep and pull it completely out. So while it is a permanent thing, it is what I kind of call a semi-permanent thing. It is just an aid to try to help you regain control of your life. There's a really cool app that Medtronic has come up with. And again, you can take your phones right now, scan this. If you just put it up to the screen on the camera on your phone, it will take you to this site. You can also simply write down the link, which is the medtronic.com/myjourney-app. This goes through a lot of the general things that I've talked about. This has videos, this has deeper educational content, this talks about the device and kind of the history and how it's been applied and how it gets used, and is a great way to get further questions answered or bring up information if it's something that, for example, you're watching this, but you want to look more deeply about it and go over it with your family, your significant other. It's a great resource for everyone. It's completely separate from this webinar. You don't have to be a patient of any doctor. You don't have to be someone signed up to have this procedure to simply access all this information. It's just out there as a resource for patients. So I do encourage you to reach out and go through that. I've had many patients find that it really answered a lot of questions and concerns that they had. There is always a question about scans once they have this device and a lot of anxiety. And when I initially started to implant this device, there was a lot of restriction on the type of scans that patients could have. But then Medtronic was able to come up with MRI and a CT scan compatible form of the device. And that is what is implanted now and has been for, 5 or 6 years. And so this means that you can safely have an MRI done. You can safely have a CAT scan. You can have a bone scan. You can fly and go through TSA. So there's absolutely no restrictions, and all patients get very anxious about this because a lot of patients who have incontinence problems similarly have back problems and are needing to keep an eye on that and get scans. So in case you've heard of this device, but someone had told you, oh no, you get that, you could never get an MRI. That was with the initial version when we were implanting it. But that is not the case currently. So a lot of people have a lot of questions and they don't know exactly where to start. And again, I can't stress enough that there are a lot of conservative things that can be discussed more in detail with your physician when you go over this. But a lot of patients, while they get good improvement with our initial conservative effects, a lot of patients do find that they need that extra boost for the nerves, because our nerves aging and our nerves getting hit with diabetes are now a super common problem for all of us here in the US. And so how do we stratify who is right for having the sacral nerve? It's when this is still a problem that is bothering you on a daily, weekly, or several times a month basis. When you have tried all the conservative things, when you did the physical therapy and it helped some but didn't really last or didn't help at all, and where you feel that you're a little bit better, but you are still really tied to the toilet everywhere that you go. Again, the slide says 89%. I'll say in my experience, it's really actually been 95%. I've even had patients who have had previous radiation for cancer who have had significant improvement with this device. It's extremely safe, very effective. Again, I have patients that I implanted over a decade ago that I monitor, haven't had a single patient with a bad side effect from it. And as far as the numbers that have been now put in between the initial launch, which was for bladder control, and then when they found how effective it was for bowel incontinence, we're at almost 500,000 patients. These next couple of slides are not just AI or Google mock-ups. These are actual people that you can access through the Medtronic Ambassador Program. And this quote by Pat literally is one of the most common things that I hear, because I hear again and again and again how patients are scared to travel, they're scared to attend events, they're scared even to go shopping unless they're absolutely sure that the grocery store has a bathroom, and that the first thing they do everywhere they go is they map out all of the toilets just in case. And having this InterStim device gives them the freedom, which is a huge source of stress and anxiety in and of itself. And it's like a huge weight lifted off of them. Again, Alan is a real person. He is another ambassador. And patients really are amazed. They come in saying, well, my doctor just said this is just what I'm just going to have to face as I get older. This is what my parents dealt with, or this is what my older sister or brother has dealt with. And I just have to face up the fact that, you know, my enjoyment of retirement or my enjoyment as I get older of my life is just, my whole world's going to have to contract. And so it's always exciting for me to be able to work with patients and just kind of bring hope and possibility back to them again. It's empowering for me as much as it is empowering and exciting for them. And this over here, this is the Ambassador Program. And again, you don't have to be a patient. You don't have to be someone who has already began the process with a physician to get the InterStim device. These are people who have seen the benefit and they want to spread the word and get the information out of there. And so I really do encourage you to, again, that's InterStimAmbassadors.com, to reach out to that. If you have questions, if you want to talk to people. I've had some of my own patients tell me over the years that they would love to be part of this program. And this is a newer thing from Medtronic, which is really exciting because it always is easiest to hear from somebody who's been through it. Obviously, hopefully you have a trusted physician like my patients who trust me. But even then, sometimes it's just a physician you're meeting for the first time and you're like, well, they don't have any problems with incontinence. How do they truly understand what I'm going through? And so it just is so much more helpful when you can actually speak to someone who has been through what it is that you're experiencing and can talk about the changes from the other side.
Thank you so much for that. Very good information. At this time, you will see another poll that's going to come up on the screen. If you will fill that one out for us, we would greatly appreciate that. And at this time, Janelle is going to come back on and do the Q&A. So if you have questions, go ahead and put those into the Q&A chat and we will answer those live. Again, if you're looking at the screen, you can see where you can call to make an appointment, as well as what's mentioned, the Ambassador Program is available for you to reach out and have conversations with. So at this time, I'm going to turn it over to Janelle.
Thanks, Kenya. I've got a few great questions here. So Dr. Forstner, is this device covered by Medicare? And if not, what is the cost?
Yes, it is covered by Medicare. In fact, it's covered by the majority of access in Arizona or Medicaid plans across the country.
Okay, perfect. Next question, will I be limited in activity?
So the only limitations in activity are around the surgical procedure times. And that there is usually about a week between the first and the second if it's done in an outpatient setting. And during that time, we don't want folks to be doing strenuous activity or exercise because the lead isn't permanently implanted. It's kind of temporary placed. For some folks who are healthy enough and willing to do a version of that as a test in the office, then there are no restrictions between that test in the office and having the device implanted. Once the device is permanently implanted, we do tell folks, we don't want you doing exercise or anything strenuous. And that's mainly for the risk for bleeding after the procedure for a week after that. And there is a restriction on pool activities in the summer, so that's always tough for folks. And soaking, and in fact, we have you kind of do sponge baths between the first and second portions of the device, again, for those patients that have to be done in a surgery center. A lot of patients are lucky enough that they can have their initial test done in an office setting, and then they don't have to go through that week of not showering and doing sponge baths. But some folks need to have this done actually in an outpatient surgery center. And those folks, which is the more traditional way of how we did this, do have to do the sponge baths between the first temporary placement and the second permanent placement. Going forward, though, you have no restrictions. I have professional ballroom dancers who get right back to doing everything afterwards. And once we're through that first kind of week, people go back to all their aqua aerobics and everything that they want to enjoy.
Perfect. How long does the battery last?
So the battery lasts a good decade plus. I do like to see patients back every year, one, because I want to just troubleshoot to make sure that the device is working well. Within the device, there are multiple programs, and those I explain to patients are different ways that the device can talk to your nerve. And again, as we age, we can get a little arthritis in our back. All of a sudden, the program we've been using starts to fail. Everybody's very stressed out. We switch to a different program, boom, we're right back into good control. And some people get overwhelmed, and so they like to have me walk them through that in the office. Although it is something that people can do at home themselves, but I like to see everybody back every year. I check the battery strength, I make sure the program's working well, just kind of check in as always with their life and make sure that other health and screening things are being done as well.
Great. I have bladder issues. Will this therapy help as well?
Yes, so that's it's kind of an interesting thing. This device initially started more for the bladder. Now the tricky thing is that the bladder, for women in particular, even more than for men, although for men as well, has a lot of different things that make it start to lose control. And it's not as strongly affected by the nerve as the bowel control is. So I definitely find that my patients do have improvement in the bladder. They don't have usually as great an improvement in the bladder control as they have in the bowel, but it does help with both.
Another question, how many years has this device been in the field?
So this device has been in the field about 25 to 30 years, but it's been indicated since 2012. So we're getting close to 15 years for fecal incontinence or bowel control.
And last but not least, another common question, will I have issues going through TSA at the airport?
Super common question. Again, as we all know, there are those two different ways to go through TSA. And so if you're in the one where you kind of have to do this with your hands up, that's the one that you want to do, and it will not affect the device and it won't beep on you. If the only option is to go through the regular X-ray at the airport, it might beep, or it might just shut off to the device. And we always warn folks about that, to just carry They're little, it looks like a little mini slim cell phone, and they can return on their device at any time. It's similar when patients are going to have their MRI. You have to take your little mini cell phone, which is the programmer for the device, and you have to put your device actually into an MRI mode. And then when you come out of the MRI, you have to remember to take it out of the MRI mode. I've had patients calling saying, I had an MRI and now the device doesn't work. And it's just because they forgot to turn it back on. Another thing that's very common is if you have a different surgical procedure. There are certain things that can happen in surgical procedures that can cause this device to simply shut itself off. And so I always remind folks, so they have this Medtronic InterStim in place, but now they're going to get their knee replaced. They need to check and probably turn on their InterStim after their knee replacement surgery, because the type of equipment that is used through a lot of other procedures can shut off the device temporarily. And so patients will be like, it's great, I have new knees, but now I've lost control of my bowels. And no, it's just that they needed to go in and turn the device back on.
Awesome, thank you. That's it for questions. So I'll turn it back over to Kenya.
Thank you all so very much. We don't have any more questions in there. We do thank you for your time this evening. We thank you for those who took the time to fill out the polls. If you want to watch the video again and just get some more information and listen to it for your own personal knowledge, it will be available for you and you will receive an additional email on tomorrow or the day after. So we do thank you for your time and hope you have a great evening.
Have a good night, everybody.